Hello, and welcome to BC Society of Transition House Children Who Witness Abuse webinar series, our webinar on attachment, attuned, connected communication. My name is Elizabeth Barbeau.
And my name is Christy Delabure O'Connor.
I teach at Douglas College in the Department of Child and Youth Care Counseling, and I've worked in the education fields and the anti-violence fields for the past 30 years. I'm really happy to be with you this morning.
And I also teach at Douglas College in the Child and Youth Care Department, and I've worked in a variety of crisis response services over the course of my 20-year career. We're really looking forward to sharing this information on attachment with you today. So we have several goals for this webinar. Our first goal is to explore the concept of attachment and review some of the research that speaks to the concept of attachment and how it's developed. We'll discuss how we can support attachment in the parent-child relationships that we support in our work as anti-violence workers. And we'll discuss attachment in children exposed to violence, focusing specifically on how we can work with children in ways that help them to feel safe and connected. In order to accomplish these goals, we have organized the webinar in 4 topics. The first topic is an overview of attachment. The second topic is how is attachment created and maintained. Our third topic is attachment in children exposed to violence and specific needs they may have. And our last topic focuses on practical ways we can support secure attachment.
Topic 1. What is attachment? Attachment theory is one way of explaining relationship and behavior. It can help us understand ways in which children and their mothers interact with each other, and it can also help us understand adult relationships and behavior. Attachment theory grew out of psychological studies of parent-child relationships. While many of the ideas presented in attachment theory are helpful to those of us who work with children, it does not take a gendered approach to understanding behavior. It's important to remember that a feminist approach to working with women and children in the anti-violence field is the foundation of our work. According to attachment theory, the attachment children form with their primary caregivers is the foundation for all relationships they will develop throughout their lives. In summary, all children attach to their caregivers. Some develop secure attachment, while others develop one of a variety of types of insecure attachment. Without secure attachment, an individual is at higher risk for relationship problems as a teen and as an adult. Research shows that many abuse insecure attachments. When a woman is abused, she may be less able to create a secure attachment with her child. There are ways to support a mother in creating a secure attachment with her child. To work effectively with children and youth, particularly those who have experienced trauma, a counselor should understand how attachment develops and what the consequences are of not being securely attached. Human beings are social creatures and may develop different kinds of bonds between themselves and other humans. A bond is simply a connection between one person and another. Attachment is the term we use to describe a special bond that has particular characteristics and is most obvious in the relationship between an infant and her or his primary caregiver.
The attachment bond has these following key elements. An attachment bond is an enduring emotional relationship with a specific person. That relationship brings safety, comfort, and pleasure. And thirdly, the loss or threat of loss of the relationship evokes intense distress. The concept of attachment was originally developed by John Bowlby and first published in the 1960s. Inspired by Bowlby's work, Mary Ainsworth studied the relationship between parents and infants in Uganda and discovered that virtually all infants develop special attachments to their caregivers. Ainsworth also discovered that some infants are more securely attached than others. According to attachment theory, new close relationships that arise later in life are influenced by these first attachments. When two people are attached, they respond to each other in particular ways. So what does attachment look like? Infants show their attachment through proximity-seeking behaviors, such as approaching and following their caregivers, and through contact-maintaining behaviors, such as touching, snuggling, and holding. A securely attached toddler is curious and eager to explore, and at the same time maintains contact by looking back at the caregiver.
Attachment is classified into 4 types. Secure attachment describes infants who are comfortable and secure with their primary caregiver. Children draw comfort from being close to the caregiver. That comfort provides them with the confidence to explore. Toddlers, for example, may climb down from their mother's lap to examine and play with a new toy, but will periodically look back, vocalize, perhaps bring the toy back to show it to their mother, or simply return for a hug. Insecure attachment can be characterized by fear, anxiety, anger, or indifference. Insecurely attached children may play without maintaining contact with a caregiver. This is called insecure avoidant attachment. Alternately, insecurely attached children may cling to their mother, unwilling to leave her lap. This is insecure resistant ambivalent attachment. The 4th category of attachment includes behavior that shifts from one type to another and is called disorganized attachment. Children who have disorganized attachment may hit their mother one minute and kiss her the next, stare blankly and then begin crying hysterically, may harm themselves and then simply freeze in place. Sometimes people mistake the type of insecure attachment that's characterized by clinging behavior and an unwillingness to leave the mother's lap to explore as over-attachment, but this is not accurate. A child can never be overly attached. Securely attached children are confident enough to explore their world while maintaining contact with their mother.
At this point in the webinar, we invite you to pause the recording and spend some time reflecting on the following questions. Think about particular children and mothers you have worked with when you consider these questions. It may be helpful to write down your responses and share them in discussion with your coworkers in your next team meeting. Discussing these ideas will help you collectively work toward greater integration of practices that support attachment within your workplace. So the reflection questions at this point in the webinar are: how can the concept of attachment help you to better understand the behaviors and responses of the children you work with who have been exposed to violence? And secondly, what do you believe about how attachment is fostered, and how does this belief influence your work with children and their caregivers? Pause the webinar at this point, spend a bit of time thinking and writing your answers, and when you're ready, start the webinar again and we'll move on to topic number 2.
Topic 2. How is attachment created and maintained? When infants are alarmed or distressed, whether by hunger, pain, fear, or any other stressor, they seek out soothing physical contact with their primary caregiver through behaviors that change with age. These attachment behaviors include crying, grasping, clinging, approaching, following, smiling, reaching, and vocalizing. Sound like any babies you know? Children use these behaviors to seek contact with their caregivers and to elicit a comforting response. In most families, these needs are met quickly and consistently by one of a few caregivers. Stability and continuity of care build trust. And over time, the child develops deeper and deeper levels of attachment to their primary caregivers. The caregivers provide their children with feelings of safety and security, allowing these children to explore the world and to know that if they're frightened or distressed, they will be safe, soothed, or comforted when returning to the secure base of their primary caregivers. This slide shows the arousal relaxation cycle. The cycle begins when the child experiences a physical or psychological need. For example, the child is hungry, the child has a wet diaper, the child is lonely or frightened. And the child experiences stress, displeasure. When the child experiences this stress, she will exhibit some of the attachment behaviors that we discussed a minute ago: crying, clinging, vocalizing. And when the caregiver, typically when the caregiver hears these attachment behaviors or sees these attachment behaviors, the caregiver experiences her own stress that the baby requires attention. And so the caregiver quickly moves to solve the baby's problem, whether it means feeding or cuddling the baby, changing the diaper, or removing whatever stressor or pain is bothering the baby. When the baby's need is met, both the caregiver and the baby experience calm, relaxation, quiescence. They both feel better after the baby's need is met. And then the cycle is complete until the next time that the child experiences a need. When this circle is consistently completed, the child learns to develop trust. The child learns that when she has needs, those needs will be met. And the child learns that she's important to the primary caretaker and that her needs matter. And she discovers that the world is a safe place, a predictable place, and a place where her needs will be consistently met. Attachment has been shown to influence almost every aspect of child development, from the growth of the child's brain to his ability to socialize appropriately with friends and classmates. When parents are able to provide the kind of care that leads towards secure attachment, the child grows to see herself as worthy of care and competent within her environment. She tends to see others around her as reliable and effective. Securely attached children seek out their caregivers when they're distressed, but they also feel safe to explore their environment when they're not upset. Children who have developed healthy attachments are more likely to be able to build and sustain other relationships, as well as to be independent. When children develop insecure attachment, they may see themselves as unlovable and unable to attract care from their parents. They may view others as punitive and disinterested in them, or as only interested in them if the child is able to secure the other's attention. Adolescents who are securely attached are less likely to engage in excessive drinking, drug use, or risky sexual behavior. They also suffer from fewer mental health problems, such as anxiety, depression, inattention, thought problems, conduct disorder, delinquency, and aggression. So we can see that secure attachment has different effects on child's development at different times in the child's life. But it's not something that only affects the babies. It affects babies and then throughout that child's whole life into adulthood.
Attachment refers to one very important aspect of the forces that shape child development. Some people worry that if a child does not have the opportunity to develop secure attachments in early life, that they are destined to have relationship challenges as they grow into adults. In fact, current research shows that attachment status and relationships between parents and children can change, and that when a child is parented in ways that supports attachment, attachment grows in the child. The take-home message from all of this research is this: it is never too late to create positive changes in a child's life. In their book, Parenting from the Inside Out, Daniel Siegel and Mary Hartzell discuss how we can communicate with our children in ways that promote secure attachment. In what they term the ABCs of attachment, Siegel and Hartzell note that we need to be attuned to the inner emotional world of the child and be able to reflect back to them that we understand what they are feeling in order for attachment to occur. This attunement allows the child to develop a sense of balance between their body, their emotions, and their thoughts. It helps the child to make sense of their physical sensations and emotional responses. This sense of balance allows the child to experience a sense of coherence, both internally within themselves and in relationship with their caregiver. They learn that they can trust the caregiver to be a safe person in their life, someone within whom they can confide and go to for help. Siegel and Hartzell suggest that attunement is fostered by connected, compassionate communication with children. To help mothers we work with foster attachment with their children, we can assist them in developing their skills in attuning to the needs of their child. One of the ways we can do this is by modeling attuned communication in our interaction with parents. We know that in order for mothers to be able to respond to their children in attachment-promoting ways, mothers themselves need to feel safe, balanced, and supported. As we work with mothers to rebuild their lives after violence, we can help them learn to communicate with their children by listening to women themselves in ways that promote safe, secure relationships. As a mother becomes stronger and more balanced herself, she can learn how to respond to her children in ways that promote attachment and attuned communication. A big piece of attunement is the physical presence and attention that the listener pays to the child. Attuned communication occurs when a mother aligns her internal state with that of her child. The mother does this through sharing and coordinating nonverbal signals with her child, such as maintaining eye contact in ways that are comfortable for the child, mirroring the child's facial expressions and tone of voice, paying attention to the child's gestures and body posture, paying attention to the timing of the child's responses and the intensity of their response.
At this point in the webinar, we invite you to consider these reflection questions, and you can pause the webinar here to think about these questions for a few minutes before going on to the next topic. As you did last time, think about particular children and mothers you've worked with in your program to help you think of specific examples. Make some notes for yourself that will help you engage in conversations with your coworkers about your ideas. Here are some of the questions we'd like to invite you to consider at this time. First of all, consider the ABCs of attachment. They are attunement, balance, and coherence. How does your approach to your work with children fit with these ideas? Secondly, how do you coach or educate mothers that you work with to communicate and interact with their children in ways that can promote attachment? So pause the webinar here, take a few moments to think through these questions, and when you're ready, join us again on the next slide for topic 3.
Topic 3, attachment in children exposed to violence. We now turn our attention to the specific needs and attachment experiences of children exposed to violence. There has not been a lot of research to date investigating attachment among infants and young children exposed to violence against their mothers, or the impact of this violence on attachment relationships. However, the research that has been done suggests that exposure to violence against a mother can have a negative effect on the development of secure attachment. One study found that when fathers were physically violent with mothers, infants were more likely to be insecurely attached to their mothers. Because they are dependent on their parents, young children are vulnerable to threats aimed at their mother, especially when the source of these threats is another caregiver, such as their father or their mother's boyfriend. One study found that when women experience domestic violence either prenatally or postpartum within the first year of their child's life, the children were likely to develop insecure attachments by age 4. Women who left abusive relationships after the birth of their children were more likely to have children who developed secure attachments. Some studies showed that a child's response to community violence can depend to a large extent on the response of the caregiver, and that the level of stress of the primary caregiver has an effect on the level of stress of the young child. More recent reviews of research on abused women are less certain about the relationship between the mother's stress and that of the child. That said, longitudinal studies have also shown that attachment status can change over time with changes in environment. Some studies have shown that the mother-child relationship improves following the end of violence and increased stability in living conditions. While further research is needed to look at the effects of exposure to violence on mother-infant attachment, the behavior of the abusive partner clearly disrupts the child's and the mother's sense of safety and creates fright in addition to any physical injury. It's also true, however, that disruptions to attachment relationships result from multiple other stressors in some children's environments, including poverty, homelessness, and separation from their caregiver. Indeed, when we consider attachment status of children, it can be helpful for us also to consider the attachment status of the mothers and the wide variety of factors that are influencing her ability to respond to her children in attachment-promoting ways. As adults, we have been shaped by our early life experience and attachment status. This attachment status is often revealed in how we tell our life stories, and research shows that the way we make meaning of our life stories influences how we communicate and interact with our children. As we have noted already, the way we interact with our children shapes their sense of attachment. Researcher Mary Main developed a tool called the Adult Attachment Interview to learn more about how parents talk about their own childhoods and how the way that parents tell us these life stories can help us determine how best to support parents to develop secure attachment relationships with their children. The more we know about an adult's attachment status, the more we can help them make sense of their life stories and move toward more coherent, attuned parenting. Children who are securely attached are most often parented by adults who experience secure adult attachment. These parents can tell a coherent story about their own childhood, one that emphasizes relationships and flexibility. Adults who are securely attached can make sense of the past, live in the present, and anticipate the future with a general sense of calm. This does not mean, however, that all adults with secure adult attachment had great childhoods. In fact, many did not. Earned secure attachment as an adult occurs when the adult can tell a coherent story about their childhood despite the challenges that were experienced. This demonstrates that attachment status is dynamic and that we can continue to develop secure attachment relationships even after we have experienced challenges and trauma. Dismissing adult attachment is characterized by parents who have little sensitivity to their child's signals. The adult seems to be disconnected from intimacy and has little attention or focus on emotion. In their childhoods, these adults may have had relationships with parents who were emotionally unavailable or rejecting. Emotional vulnerability and dependence on others is minimized. When an adult experiences dismissing adult attachment status, they are likely to parent in ways that create an avoidant attachment status in their child. Preoccupied adult attachment occurs for adults who have been parented by caregivers who were inconsistently available or perceptive and responsive caregiving. These things were inconsistent in the way they were parented. They respond to their own children with anxiety, uncertainty, and ambivalence. When a parent is experiencing preoccupied adult attachment status, they may be flooded with memories of the past, which they are unable to make sense of. This flooding gets in the way of them being able to attune to their own child's immediate need for comfort and safety and nurturing. Their children demonstrate behaviors often associated with ambivalent attachment, being clingy and unsure of what to expect from their parents. The last category of adult attachment status is unresolved adult attachment. Parents with unresolved trauma can appear to enter abrupt shifts in their states of mind that can be scary and disorienting to their children. For example, a parent may space out when their child is crying, become enraged when a child starts singing a song that the parent perceives to be too loud, or hitting a child who asks for another bedtime story. These behaviors result from a dysregulation of emotion and life history in the adult. The trauma that the adult experienced was so overwhelming, and time and support has not been provided for the adult to make sense of the experience. They become flooded with emotion and energy and respond to the trigger, the memory, rather than responding to the present moment with their child. A child who is parented by an adult with unresolved adult attachment status often engages in behaviors indicative of disorganized attachment status themselves. They get caught up in their parents' chaotic and disorienting behavior, and they experience a sense of fright with no opportunity for resolution. Just as with childhood attachment status, adult attachment status can shift and change with support, encouragement, and therapeutic intervention. Siegel and Hartzell suggest that adults need time and good therapeutic support to help them make sense of their early life experiences. They can develop strategies to make sense of their life histories and feel a sense of internal balance that allows them to respond to their children with attuned communication that supports secure attachment. As anti-violence workers, we can pay attention to the communication patterns we witness between mothers and children and respond with gentle compassion, recognizing that a lifetime of experiences are shaping each interaction we witness. We need to be patient and encouraging in helping women to respond to their children in ways that may feel very new and difficult to them. We need to model safe, secure, consistent communication with the women we work with, the children we work with, and among the members of our team. When a woman is listened to, heard, and respected, she can more readily respond to her children in similar ways. So let's now shift our focus from discussing what attachment is and why it is important to how we can support secure attachment.
Topic 4. How can we support secure attachment? Before we review some strategies for supporting attachment between mothers and the children that you care for, we'd like you to take a few moments to reflect on your own practices and ideas about how best to support the folks you work with. What do you already do as part of your practice that supports secure attachment relationships between moms and their children? What are some of the unique needs that present themselves in transition houses and in the Children Who Witness Abuse programs in regard to attachment? And how do you respond to these needs? At this point in the webinar, we invite you to pause, spend a few moments considering your practice and your response to these questions. Make a couple of notes for yourself and consider sharing your ideas with your team at your next meeting. When you've had a chance to do that and you're ready to go forward, join us on the next slide. There are some concrete ways that we can support attachment between mothers and their children. For those of us who work with mothers and children that have lived with violence, here are some practical suggestions. Children of all ages need secure attachment, and the means of supporting it change as the child develops. How we interact with a baby who is 6 months old to promote secure attachment differs from the way we would act with a 14-year-old. However, there are common threads that we can see throughout the interactions, regardless of the age of the child. Care, attention, consistency, and above all, communication. Number 1, encourage the mother to develop a secure attachment through her care for the child. Regardless of age, children and youth need relationships with caregivers that are compassionate, consistent, and available. Remind her and support her in providing comfort for her child when she needs it and in the way that the child needs. Providing necessary physical care, such as nutritious meals, clean clothing, bathing the baby. Talking and singing to the baby. Listening to the endless stories of the 7-year-old. Being empathetic with the teenager's angst and supporting them in their own emotional development. Trying to stay calm in difficult times. Responding to the child's fears and concerns and desire for comfort in ways that are developmentally appropriate. It is especially important to respond to a child who is sick or hurt or upset, such as feeling sad or lonely or frightened. These are the moments where the child is working her way around that attachment cycle that we saw a few slides back. Number 2, reassure the mother that she cannot spoil the child by responding to her or his needs. Responding to a child's needs makes the child feel safe. This is the core of the attachment bond. There is no such thing as being overly attached. Notice that there's a difference between responding to a child's needs and responding to a child's wants. You don't have to do everything the child says, and you do have to step forward when the child is exhibiting a need. Number 3, remind the mother that the best way to develop a secure attachment is to create an environment that is predictable and safe. The child needs to know that their needs are going to be met. Help the mom develop a realistic safety plan for herself and her children. Number 4, support the mother in feeling safe herself so that she can nurture a sense of safety in the child. Many of the mothers that we work with will themselves have had insecure attachments within their families of origin. We can help the mom by treating her in the way we hope she will treat her children. For example, create an environment within the transition house or within your program space that is comfortable and predictable and feels safe. Attend to the mother's physical needs if that's appropriate. For example, in a transition house, help her find nutritious food. Help her find clean clothes if she needs them. And lend an ear to listen to her story if she's upset or lonely or sad. Respond to her fears and worries with empathy and concern. Project a sense of safety and calm. Let her know that you're strong enough to support her in regaining her own strength. As with children, it's especially important to respond to a mother who is sick or hurt or upset. Number 5, support the mother in attending to her child by speaking for the child as necessary. This means using the child's point of view to express the child's needs. For example, "Mama, I'm hungry. When are we having lunch?" Or, "Mom, I'm cold. My diaper is wet. I need you to come and hold me and clean me up." Sometimes when the mom is wrapped up in meeting her own needs, she may forget to listen to the voice of the child. And particularly when the child is too young to speak with words, it can be helpful for us to put those words into the child's mouth. And number 6, model for the mother appropriate childcare activities, depending on the age of the child. For example, model using eye contact when speaking to the child, using a gentle voice when directing the child, and using positive language. For example, instead of saying, "Don't climb on that table," you can say, "Come and play with this toy."
The last slide focused more on younger children and how we promote attachment between parents and children in the early years. We often have the opportunity to work with parents as the children are in middle childhood and into adolescence, and it's important for us to think about how do we support parents to continue to develop and strengthen the attachment relationship they have with their children at this point. So we'd like to talk about a concept that Siegel and Hartzell discuss called rupture and repair. Even the most balanced, emotionally connected parent loses their cool sometimes. Part of promoting secure attachment with older children and teenagers involves paying attention to how we repair ruptures in our relationships with our children and reconnect with them in ways that demonstrate that we love them and care about their feelings. Ruptures can happen when we are flooded with emotion in response to the action of our child. Typically, in a rupture, our response is out of line with what the child would normally expect from us in similar circumstances. Something causes us to blow, and we act in ways that may surprise or frighten the child. We may yell, stomp, or throw an object down onto the floor. Ruptures have the effect of destabilizing our relationship with our child. The person they normally come to for safety and security is responding in ways that create feelings of insecurity and fear. These ruptures are a part of life. We all have times when we feel less resourced, less supported, less well-rested than we would like. And parenting tests our patience.
Amen.
While these moments of rupture are not our finest moments in parenting, we can recover from them. How we repair our relationships with our children matters. When we move to repair, we first need to calm ourselves. We cannot have an attuned conversation with our child if we are still flooded with whatever emotion prompted us to yell or stomp in the first place. We need time and space to return to a place of balance and coherence within ourselves. Retreating to a quiet space to take some deep breaths, splashing some cool water on our face, sitting down and letting the sun shine on your face and shoulders, whatever helps you to ground yourself and find a place of calm. Once we are calm, we need to reach out to our child and explain that we want to talk about what happened and reconnect with them. At this point, it is very important to pay attention to the nonverbal cues from your child. Some children require longer time alone before they're ready to reconnect with the parent after a rupture. Reassure the child that you are there when they are ready and that you will check in with them again in a set amount of time, say 15 minutes, if they haven't come to find you. Listen to your child's thoughts, feelings, and experiences of the rupture without judgment. This is the hard part. Using empathy and trying to understand the experience from your child's point of view without interjecting your own thoughts and ideas will help them process what has happened and will foster a return to a place of reconnection. Once your child has had the opportunity to talk about their feelings and thoughts, you can share your own thoughts and feelings with your child. Discuss how you could handle the situation differently next time. The way we repair teaches our children that everyone loses it every once in a while, and that conflict does not mean that the bond of attachment is broken. In the process of repair, we have the opportunity to convey love, commitment, consistency, and safety. These help us to maintain the attachment we have built through our interactions with our child.
In summary, attachment is an ongoing, dynamic, relational process. It is never too late to find ways to improve attuned communication between parents and children. Adults can find new ways to relate to their children and make sense of their own life challenges in ways that allow them to connect in secure and supportive ways. As anti-violence workers, we can model attuned, compassionate, connected communication to support attachment among the women and children with whom we work.
We've provided 2 slides at the end of the webinar here that include the references that we have utilized in the preparation of this webinar. We hope you find this information helpful if you would like to do extra reading on the topics we've discussed today.
Thank you.
Thanks for your attention.